We're back. I'm Brian O'Neill. On now with Horace Cooper, who's with the National Center for Public Policy and a former constitutional law professor at George Mason University in Virginia. Horace, thanks for coming on.
Thanks for having me on your program today.
Horace, in the compromise that came out on Friday, the deal worked out is that the Catholic-run employers like hospitals, charities, and other nonprofits will be able to provide their workers with insurance plans that exclude covering birth control, but the way around it is employees who work for Catholic organizations, these employees that want birth control, they can go to the insurance companies and get the birth control without having to go through the copay, so no additional charge there. Here's what President Obama said about this at yesterday's press conference in Washington.
The insurance company, not the hospital, not the charity, will be required to reach out and offer the woman contraceptive care free of charge, without copays and without hassles. The result will be that religious organizations won't have to pay for these services, and no religious institution will have to provide these services directly. Let me repeat, these employers will not have to pay for or provide contraceptive services. But women who work at these institutions will have access to free contraceptive services just like other women. And they'll no longer have to pay hundreds of dollars a year that could go towards paying the rent or buying groceries.
Horace, your reaction to that?
Well, I'm appalled on a couple of fronts. The first is if these birth control services are completely and totally free, are they just hanging in the sky? It's not clear to me what that means because I understand this concept. If the insurance company has to provide this service, they are going to change the rates that they charge all of their employers, including those who object on religious grounds, to cover the cost of providing them. It would be different if he had said it's okay to charge the individuals an additional fee to have this benefit. But no, because the insurance company is bearing the freight, they're going to charge the employers. And that is the very objection that was put forward. Religiously affiliated organizations who happen to be employers objected. This doesn't change that. The second part is, even if you thought this changed that, which it doesn't, he now has said that the only people that are going to get this even slightly adjusted protection are people who are somehow affiliated formally with the church. The First Amendment says that every American as an individual is allowed to be free to exercise their right, free from undue, unnecessary, and less than compelling governmental restrictions. This doesn't meet that test.
Now, Horace, you argue that really this is not a compromise at all. Can you tell us about that?
Sure. The part of the problem is a discussion appears to have been held only with the administration, not with the impacted parties, not with the people who are complaining, and not with the entities that would provide this service. If they had sat down with the insurance companies would have explained to them, whatever we are required to cover, we will gladly do so. It just comes at a cost. And we are going to allocate that cost along the lines to our employers. Unless you say that the only employers who can pay are non-objecting employers, all employers are going to cover the freight. The other point is that he still fails to appreciate you don't have to work at a soup kitchen to have a moral objection as an employer of providing contraception services. You could work at McDonald's, you could work at a KFC or any kind of a place and be an employer who personally and is morally opposed, and you have the right under the First Amendment to have that reflected and provided for. This exemption doesn't do anything about that.
Now, House Speaker Democrat Nancy Pelosi spoke about this issue at her weekly press conference. Sound here courtesy of both C-SPAN and Breitbart TV.
That will be a debate that we welcome. It's a sad one. We shouldn't have to be to a place where people are saying when the overwhelming practice is going in favor of women's health, we want to pull that back and use the excuse of religious freedom, which, of course, this is not.
Horace Cooper, to you, is the Catholic Church using the excuse of religious freedom to push their religious values?
I find that very troubling. Religious freedom is a constitutionally protected right. Let's put this in perspective. Religious objections are conscientious objectors who do so on religious grounds are allowed to be exempt from sitting on the front lines of war in whatever war this country has ever been in, be it the Civil War, World War I, World War II, Korean War. No matter how serious the threat, we have always understood that conscientious objectors who do so on religious grounds would be exempt from having to carry that out. If you grant that the war-making activity of any government is its most compelling duty, and yet you allow a religious exemption, how is it that you can't allow that similar kind of an exemption from just birth control, abortifacient, and other related contraception funding? How is it that that would trump even the treatment of religious objectors in the war context?
And wondering, Horace Cooper, you're a constitutional lawyer. Will this ruling that the Health and Human Services came up with a few weeks ago and the Obama compromise from yesterday, does this set any negative precedents that we have to watch out for?
Well, I think this is going to be challenged if the administration doesn't get it right, and the best way for them to get it right is to ask the Congress of the United States to enshrine in law a exemption for people who have a religious objection to funding any of these kinds of abortifacient or morning after or related contraception services. If they don't do it that way, they're running the risk that the courts themselves are going to end up dictating that this exemption exists. It's fundamental in our system of government that you cannot have a rule that restricts religious liberty unless you can demonstrate that it is the most compelling need that occurs and that it is being handled in the least restrictive way possible. In no case does this meet that test.
Just learned that Catholic TV EWTN's filed a lawsuit in federal court in Alabama against the Obama administration's HHS ruling. You think that has any chance, Horace?
Well, it may be premature if the rule hasn't actually been formalized yet, and so I would imagine that a temporary restraining order is going to have to be carefully presented in order to meet the requirements for court consideration. However, the concept of a case like that is, I think, at every stage, at the district court stage, the circuit court stage, ultimately, if the feds want to waste the resources all the way to the Supreme Court. The point here is this is closer to a slam dunk type situation than it is to a questionable new issue that is novel and one that needs the Supreme Court to opine upon. When the courts weigh in on this, the degree of decisiveness will surprise, I guess, the Obama administration, but I won't be surprised.
Horace, conservative Catholics argue that both the Amish and some Muslim groups are excluded from having to obey the Obama administration's HHS rule on this. Do you know anything about that, and do you think the Catholic Church is being unfairly singled out on this issue?
Well, I do know that there are exemptions for the Amish. I'm not clear on other religious organizations. Here's the thing. There was a 1990 decision, the Oregon v. Smith case, involving Native American Indians who were denied access to unemployment assistance because they were using an illegal drug as part of their religious rituals. And the Supreme Court said as long as the law applied to everyone and it resulted in a person's religious expressions not violating an already existing law, this would be acceptable. In this case, we have the exact opposite of that. There are exemptions for the Amish. There was an exemption for the Catholic Church and other religious organizations. When you have a hodgepodge of exemptions, now the burden shifts to you to explain why you're not going to give an exemption to another person who expresses a liberty interest based on the First Amendment. So whether they're singing out the Catholics or not, what the First Amendment says is no individual can have their First Amendment rights restricted, and in this case, that's what they're doing.
Chris Matthews from MSNBC, who's normally very liberal on just about any issue you can pick, he has a very different take on this subject.
It gets to that interesting point, to me, which is frightening, when the state starts telling the church what to do. And then the church can no longer teach. If the church teaches it's morally wrong to use birth control, how can you make the teacher pay for birth control without losing their authority, their moral authority? That's what the church is afraid of. If they start financing under the law what they're called to do they have any more credibility on the issue of birth control or anything else? That's what I think is the concern here.
Well, I think he's on to a point. The recent case last January, the Hosanna Lutheran case, stood for the proposition that the government can't be in the business of trying to in some way influence or dictate what the religious precepts of a religious person or organization are. And yes, you run the risk that the church's moral authority to be against contraception is undermined if the church itself is handing out condoms.
Horace Cooper, a member of the National Center for Public Policy and a former law professor a constitutional law professor at George Mason University, thank you very much for joining us today.
Thanks for having me on your program.
Well,